Hello, what is up, bread fans? Welcome to this episode. We have another cool conversation for you and another group conversation for you. I invited several folks over for dinner and a podcast. I enticed them with my famous bean burritos. So I want to thank everyone that came by. We had friends from Marburg here, two psychologists, researchers. Izgi is one, Toby is the other. They'll introduce themselves in the episode. And had my good friend Aaron join, who, while not a researcher, is a really smart dude. Studied linguistics, German, computer programming. Anyway, he felt a little out of his element, but I think you'll find that he was a pretty solid contributor to this episode. So we covered behavior, sort of started off like why you study animal behavior, a little bit about cognitive behavioral therapy. We tried to kind of tease out what that is, how it works, moving on into mental health in general. Is our society contributing to poor mental health? Of course, that touched on social media, my favorite. And yeah, it was just a fun chat, close to the holidays here. So we had a few drinks, had a nice chat. We were joined partway through by a couple other friends who were in the lab working hard all day, but showed up right at the end to help us out. And that would be Uzga, who you'll hear. She was on the show before, the In Conversation episode we had about the gene editing. And she also works in the labs here in Marburg studying animal behavior. So like I said, good times had by all. I really enjoyed it. I want to thank everyone for taking part. And we'll get into the conversation after this little bit of the freak motif. So thank you all for being here. We got a big group, fairly big group today. Yeah, well, there you go. There's Toby.
Yeah.
Tobias,
but I prefer Toby.
Okay, we'll go with Toby. So Toby works in the lab with my lovely wife Teresa, who has been on the show. So we'll get to that later in just a sec. But we got a couple audience members, participating audience members.
Yes.
So Izgi.
Hi, I'm Izgi.
Izgi's here. You've done your PhD in psychiatry?
Cognitive neuroscience.
Oh, okay.
Yeah.
Ooh, oh, fancy.
Yeah.
And then we got Aaron from the mean streets of London with the PhD in life.
Hello.
All right. So that's the crew today. And we got the Christmas tree in the background shining brightly. So
looks amazing.
Festive mood. Cheers, everyone, for being here.
Cheers.
Raise a glass. But Toby, the original idea, I wanted to have you on the podcast for a while because you work in the same lab, like I said, as my wife Teresa. That's how we met. Studying behavior. This is what Teresa studies, and we've talked about it. Teresa's been on the podcast before, so we've talked a little bit about behavior, and you study animal behavior.
Yeah.
But you are also training to be a clinician.
Yeah, a clinical psychologist. So I'm trying to close the gap between animal and human behavior.
Right. And so this is kind of the interesting thing for me because, when you think about behavior, like no one really thinks about their behavior. We know what behavior is. Everybody has behaviors, but we don't really know why we behave or why some people behave differently than others. There's obviously psychiatric disorders, and that comes with some changes to the brain or something like that, but it manifests as behavior or altered behavior.
Yeah,
maybe you can,
right.
I'm kind of rambling on about it, but maybe you can kind of just give us a glimpse of like why studying animals, in behavior and what you're looking to bridge, I guess.
Yeah. Okay, I mean, there's a huge gap between animal and human behavior. But based on the diagnostic systems we are using in Germany or in the US or wherever, for mental disorders, it's based on behavior. Not most of it, but we use behavior to behavioral symptoms to make our diagnosis. So the systems we are using, like the DSM-5, the diagnostic statistical systems we're using, are relying on that. So it's interesting to look on behavior. And in my research part, we are focusing on behavior in rodents and mice and rats, and especially in genetically modified animals. That's what I'm interested in.
Well, and so this is the thing, that right? Like you're saying that like the symptoms of mental disorder. I'm probably using the wrong language around here, but is behavior. So it's not like you can really, it's not like a bacteria infection where you take a blood test and say, oh, this person has this disease or this virus or something like this. So you're relying on behavioral symptoms.
Yeah.
But like you just alluded to, you work with genetically, modified animals.
Knockout animals, yeah.
So there is a biological link to the altered behavior. And I think
that's idea.
Yeah, right. And that to me is kind of the interesting thing, because it's like then you're thinking, we don't think about our behavior, but there is kind of a biological reason for the reason we do things. Does that make sense?
Yeah.
Izzy, you're agreeing?
Yes, I'm agreeing. And maybe, it's also important to add that, like some fields in psychiatry, neurology, I'm also not that specifically informed, but they are trying to find other markers that would tell, for example, if someone has schizophrenia.
And so these markers
apart
would be
from the behavior,
right, and
like
that
more
marker,
physiological markers.
What's an example? Like, is it like serotonin or something
eye
like
movements, for example.
Ooh, but that's
It's
kind of a behavior, isn't it?
Yeah, you think so? saccades, because you're not like in control of like when you make a saccade, right?
What's a saccade?
Oh,
it's a specific eye movement, I guess, but
like
you're
very
the expert.
short.
Yeah. Okay, so it's kind of like an involuntary behavior, like a tick or something like this.
Yeah.
But
no, it's a normal behavior.
Okay.
You're doing the same when you're
you're
moving your eyes, when you're focusing on stuff, you're showing saccades. It's a specific eye movement, I guess. So that's what I've learned. I'm not really into this stuff. But
I'm also not really into this stuff. I just want to add that like different fields are trying to look for markers other than behavior, so that they would kind of make sure that, they will try to define the disorder as they would define, I don't know, like if you have cancer, what exactly that's about.
Right, exactly. And that's kind of the tricky part with mental illness at the moment, is that it's, for someone who, hasn't studied it, you hear about the spectrums of symptoms and severities and stuff, and the challenges with diagnosing. But this is, I guess, kind of the point that I'm a little stuck on, is just that, we know that there's some genetic component to a lot of these things, right? Like would you ever find someone that you would diagnose as schizophrenia without having sort of some other biological or genetic sign of it? Is that possible? Maybe we don't know. I don't know.
They usually have a history in the family.
Right, which alludes to a genetic component.
Yeah, but right now you're not doing any like genetic tests
to
find it. In the clinical, so in the clinic where I work, you don't do any genetics to get a reason for the disease.
Yeah.
So it's not based on any like.
Is it because we're at a point where it's like there's not like one clear gene? You can't like just run a test and say, oh, you have this gene or you don't have this gene, therefore you will have this. That doesn't exist. And I think that's maybe the thing that people don't understand.
Really rare diseases, but they're like the Huntington disease, for example.
Right.
But these are really severe disorders. But for like schizophrenia or depression, for example, you don't have this one specific gene. So it's not necessary right now to find this one gene. And I think the idea right now is it's an interaction of different factors. So in the models for diseases we have right now, we assume that there are like biological factors, sociological factors, right?
Like environment.
And environment and psychological reasons, or
And it's like trying...
It's a combination of it.
And to try and tease out how much each of those factors plays a role in getting it...
Yeah.
Yes.
Manifesting the disease, we'll say, is really, really difficult.
Yeah.
That's my understanding too.
Yeah.
So that's kind of the interesting thing. I mean, it's interesting, but it makes studying this stuff like next to impossible, really. Because how would you ever, sort all this stuff out, and how can you even then accurately diagnose it? So, I don't know, Toby, I mean, maybe you could talk about what is a like classic behavioral diagnosis for some of this? What are the things that you look for, and is there a threshold? How would you, or do you kind of just go with your experience, your gut?
So, I mean, we have the diagnostic systems. We look at the symptoms, and then most of the time you use you check if the symptoms are there for a specific amount of time, and then you look, for example, in depression, or for depression you look at social withdrawal, for example. If people don't go out anymore, stay at home, whatever. So this is what we use to do a diagnose, to get one. Yeah. But no, does this answer your question?
Yeah, no. I mean, it does. I can just imagine how difficult it is. And I think this is a thing that like a lot of people struggle with. I know, like, if you've ever had somebody with a mental disorder in your family, it really disrupts the family because people don't understand, right? Like, they don't understand that, like, well, why aren't you just better? Like, why can't we just make you better?
Yeah.
And when you talk about genetic factors or biological factors, people think that there's a way that, well, why don't we just give them a drug? Like, why don't we just cure them or something like that? And this is maybe where my interest in your speciality, we'll say, is what cognitive, how do you say it? Cognitive behavioral therapy?
Therapy, yeah.
CBT, yeah. Which, because then it's like, then it just seems like, oh, well, you're just training. Like, it's, this is the naive perspective of it, is you're just training the person to not have those problematic behaviors or something, along these lines, where it's like, so are we really curing it? Like, is it a disease? What's happening there? Because if it's just a matter of, well, I just have to behave differently and I just have to learn how to behave differently, then, it should be easy, right? But it's not. So maybe you can, I mean, I'm probably butchered your whole area of your thesis, but maybe you can like outline the CBT and how it works, or...
Yeah, I mean, some part of the CBT means you try to adjust behavior to, so one step in CBT treatment for depression, for example, is to make people go out again, to do like positive activities, and then by doing this to try to change the depression, to reduce the symptoms in general. So this is how you try. This is one step in CBT. It's more the behavioral part of CBT. And there's also a cognitive part. But the first steps would be, for example, to have like positive activities how do you say it? Sorry.
No worries.
To integrate these activities into
so the symptom is withdrawal from depression. So then you would encourage them to go out in public, or maintain the relationships with their family and stuff. Yeah. And then, so that's the behavioral part. Yeah. So what's the cognitive part?
So in depression, for example, you talk about specific cognitions they have. So I don't know, do you have an example of typical cognitions?
So they tend to generalize, I think, negative thoughts to mostly everything. Like, I don't know, like if they fail an exam, they would say like, I'm a failure in everything. So
Yeah.
that's one cognitive style that
For
they
example.
So it's like by
Tend to
cognitions and this cognitive, it's like thought patterns.
Yeah.
yeah, I mean you can
Okay.
yes. Mhm.
All right. So then you have to address those. So then how do you address that? You just talk about it?
That's kind of tricky. Yeah.
Because like how do you convince that person that they're not a fit, like if someone's trapped in that thought pattern.
Yeah. Have you ever tried to convince a person?
Maybe you could try now.
You could try it now. Yeah, I mean that's the tricky part of the cognitive therapy. You don't want to convince the person. You have to somehow guide the person to another more helpful cognition. So it was maybe when we did, the example was you
Like
failed an exam,
Uh-huh.
generalization. Sorry, difficult word for a German speaker. So there you could say, are there other reasons why you failed your exam? And then you can
Maybe.
try to find different reasons. I don't know, what could be another reason? Do you have...
Maybe they didn't study enough.
They didn't say, That's not, but this might not be a good reason for a depressed person.
Right.
But maybe maybe 50% of the other students failed, then the exam was too hard for you. So
Yeah.
but you try to find different reasons, and then you start to discuss them, and then you try to change the first cognition.
The perspective or the thought. Yeah.
Yeah.
How do you kind of list the different cognitions?
You can write them down. That's easy.
But is it not kind of endless amounts, or do you pick a specific set amount? I mean, for example, talking about this failing a test,
Yeah.
it's very specific one point. Is there, I don't know how you would approach how many different points there are.
It's a good question.
That's a good question. Let me think about it.
Well, so because you have a patient.
Yeah.
And I mean, like depression, maybe one of the examples that I know you've used in the past when we've chatted about this is not depression, but let's say someone who has paranoia.
Yeah.
Or something like this. Then it makes this is an example that stuck out to me, because then you can be like, the person's like, oh, I'm paranoid. There's someone outside my apartment. They've been standing there for an hour. They must be after me. And then you could list all the reasons, like, well, what are the reasons that a person might stand out there? And there's all these other reasons. It's not that they're after you.
Yeah.
But then there must be, like, they keep, how often, I'm curious now with what Aaron said, like, is there, like, in depression, is there, like, 3 cognitions that you could even use as, like, diagnostics? Like, or it manifests differently for everybody? So like depression or paranoia or something. Like paranoia, would it be like, the cognitions are everyone's out to get me, strangers are somehow following, like is there similarities between patients that you could make?
Do you have an idea, Eski?
I mean, I'm not a clinical psychologist. All I know is, I don't know, I just saw some patients during, while they were being interviewed, but I wasn't the one who was interviewing them. But I mean, my understanding is that, like, case like depression, for example, I think you can more or less provide an overall picture of what the situation might be, or how it might lead to a failure of the exam with cognitive therapy. But when we talk about paranoia, I think that's a bit different. So I don't think
and it's kind of
every condition is curable, quote unquote curable, by cognitive behavior therapy.
Right.
And
as well.
Just to let you know, in the last decades, CBT was psychiatrists didn't want CBT therapists to treat like paranoia or something. So they've just started using CBT for paranoia in the last, I don't know, couple of years. So
It's
the
new.
therapist always stepped back. Always what the psychiatry always said, no, the paranoia or schizophrenia is nothing you should treat with CBT. So it's kind of new right now.
Right.
Is there a reason behind that?
Was it because like schizophrenia, there's like antipsychotic drugs?
Yes.
Right, like are these
Yeah,
the
they-
disorders that you can actually
I think
more reliably treat with drugs?
one reason was that that they assumed you should not like try to change the delusion. Is it delusion the real word?
Delusions.
The delusions, but this is changing right now. But I'm not really into this, so this is just what I've learned.
Yeah, no, it's fine. It's interesting. And so maybe I've muddled the whole conversation by bringing in two different examples, but it's interesting that there's, there is like this cognition and then behavior. So like the cognition, the thought patterns sort of then lead to the behavior. Like because of the cognition, then that influences their behavior. This is my thinking on it. And so you kind of have to address both in order to sort of break out of this cycle.
Yeah.
Right. Interesting.
Interesting.
But it is like when it came to the, how do you convince somebody? I guess that's not really that's what you kind of said too. It's like we're not really trying to convince them. So it's like dancing around the point, like trying to guide them to a new thought. Like let's say like what are the other reasons why this outcome might have happened rather than this one that you're stuck on. So that's kind of interesting because you could apply that to so many things. There's I think we've talked about this before where it's when you're trying to like for climate change or something, some of these contentious issues like this or anti-vaxxers or something like this, you're like, it doesn't matter how much data you put in front of someone. You can tell them like, no, all the trials have come up safe and everything's fine, like, but it doesn't matter.
Yeah.
But if you start to like ask them questions, like, well, how many people do you know that are vaccinated? And they'll be like, oh, well, like my whole family, like I was vaccinated as a kid too, but I don't want to vaccinate my kids. And like, yeah, but so how many people do you know that are sick from do you know anyone? And then so it actually seems like a pretty, like, I'm fascinated by it because it seems like a pretty useful approach to sort of dealing with like entrenched thoughts or behaviors, I guess.
Yeah, but imagine, for example, the daily life of a person with a depression or whatever. What they are used to are like parents or partners, whatever, that are like trying to force them to do stuff, to convince them doing stuff. So they're really used to that there are people pushing them.
Yeah.
And I don't like to get pushed somewhere. I guess you don't like it, so... Yeah, this is why we have these techniques or different approaches in CBT to talk about cognitions. So
Yeah. And maybe one other thing which is, I don't know how related is that, but I find very important, like when someone with depression comes to your office, for example, I think it's very important that he or she is motivated to get in or to receive therapy. Do you think?
Not all of them.
So I can imagine someone just going into your office and saying that, oh, I was just forced to be here.
I mean, this happens too.
Yeah.
I mean,
with adults.
Sometimes they get forced by their partners to go to therapy, and then you have to address it because otherwise you don't have to do the therapy or you don't have to start the treatment because they will be reluctant.
Okay, but do they keep coming to the therapy or like what would be the success rate then,
so
if they are not motivated?
I don't have any numbers, but in the beginning you try to address it. If you as a therapist you get the feeling that they are like forced, you try to address it, and then you try to show them that you understand their position, that it's like uncomfortable to get sent by your wife or husband to a therapy, and then you try to like find a way with it together with the patients to talk about his problems, because I mean most of them have problems. So,
but that's kind of the thing that again, like the narrative you hear a lot when you're outside of it, or you have a family member or something, or you know, they say this with addiction and stuff like this. It's like they won't get help until they want to get help, or it won't succeed until they, you know, they're ready to like give it an effort. So is that because they have to buy into it?
What do you mean by to buy into it?
Well, like, you know, they have to, well, because you're not like tricking them, right? Like that's not the goal, is just to like trick them into like, oh yeah, you know, yeah, I'm everything I was thinking, you know. So they kind of have to be open to changing their perspective.
Yeah.
Right?
Or their behavior.
Or their behavior.
Or both.
Right. Right. So
Yeah.
if someone's not open to that, then they're not going to do it.
Yeah,
And
you don't have to do a treatment.
yeah, and so then, but I think this is what people struggle with too, again, like family members and stuff, because then it's like, well, this person doesn't want to get better. Like, they could get better, but they're choosing not to. Is that safe? Like, can you say that? Or is that...
I mean, in some cases, I guess it's like this, but sometimes as a therapist, it's easy to say, yeah, they don't want to change, so I can't do a therapy. But maybe that's a challenge, to address this in the therapy and then try to get a good relationship between patient and therapist, and then you start to talk about this problem first, and then I don't know. It's tricky.
Yeah.
I mean, therapists are facing this problem each day, I guess. So.
What would you do in such a case when people are reluctant for therapy and you can't really get through to them? Do you switch therapists, or you just write it off and you say, look, this person doesn't want any help? Or is there some kind of, do you put them on certain medicines?
I mean, most of the patients I've seen are in an out clinic, I guess. Is it the right
Outpatient.
word? Outpatients.
Okay,
They
yeah.
were outpatients. So most of them were motivated. I've never worked in a psychiatry, so there it might be different. There, so in the field where I've worked, people were somehow motivated, so it was much easier. But in the clinic, they might get medication. Sometimes they are forced to get medication, but this is kind of tricky too.
But so in a lot of those cases, and maybe it's important to make a distinction between therapy or psychology, cognitive behavioral therapy, and psychiatry, because my understanding is that psychiatry is more the use of drugs. They use drugs more. Is that...
They have access to drugs.
Yeah, I mean, they're medical doctors.
Yeah.
So
Okay, so they can prescribe drugs.
prescribe it. Yeah, in Germany, so psychological therapists, therapists that study psychology are not allowed to prescribe medication. So this might be different to North America.
No, that's my understanding in North America as well.
And and for some diseases, at first you need medication, and then you can start the therapy.
Right. And so then, this is, kind of weird that it's okay, you're dealing with schizophrenia, for example, where there's clear delusions, whether it's auditory or visual or whatever it is. So you first need a medicine to deal with that, to try and stop those. So we must know kind of what the biological reason for hallucinations or delusions are, right? Is that safe to... I mean, we have antipsychotics. What do they do?
Yeah, I mean, I think they work there are different types of antipsychotics, but they work on the dopamine system. I think the traditional ones, but I mean, I wouldn't say that much because I'm not a medical doctor.
It's okay.
so-
We're just podcasting. No one's gonna hold you to well, you said this and no. Don't worry. It's fine.
So about the medication, so my understanding right now is, I mean, there is a lot of different medication for mental diseases right now, but in many cases we don't really know how they work. There are ideas that
Oh,
they
exactly. Maybe, yeah.
change
Yeah.
the dopamine system or the serotonin system, but the main mechanisms, from my understanding, are really unclear. And maybe sometimes the research on mental disorders is somehow biased because, I mean, psychiatry, it's part of the medical field. There's a lot of money, a lot of funding.
Yeah.
So they a lot of power to decide what to do your research on. Sometimes they try to find the biological reasons, and I'm totally sure there are biological reasons, but they are biased on this biological reasons. Maybe this is another
And
topic
I
we
mean,
should talk about.
Yeah.
Or it's another interesting topic.
And like, for example, when you think about a condition such as schizophrenia, most of the drugs work on these positive symptoms that we talked about. Delusions, hallucinations, and so on. But there are also negative symptoms. And most of the drugs, they actually don't work on these symptoms, like feeling very demotivated, feeling or looking like they have no affect, and so on, like
That
stuff like that.
blank, emotionless.
Yeah.
You can't do much with antipsychotics. So it just works on some of the symptoms that this syndrome
Presents.
Yeah, exactly.
That's always like kind of terrifying. That like we don't really know how they work. And I mean, I've heard this a lot, like listening to people talk about depression or something like this. And this is why people with depression will cycle through medication, because they're basically just like, well, let's try this at this dosage. And it's did it work? No. Okay, well, let's try this one with this dosage. And you're constantly, and I think that's something like, maybe this is why people don't trust, or there's this narrative that gets built about not trusting, pharmacy or whatever, all that kind of stuff, because it's like, well, we don't know, but I don't know, we just got to figure it out, I guess.
I mean, it's sometimes the case with other medical issues. I know with epilepsy, they have to cycle through different medications. There's loads of them. It's a trial and error. So perhaps, I'm not sure. Yeah.
I understand. I guess I kind of just understand why some people are skeptical. I mean, I'm not. Vaccinate your kids. Come on. But
mental illness has been kind of demonized for quite a long time. It just seems in the past few decades we've really started to open up to treating and sorting out these problems that people have.
So the research is probably like lagging behind. But is that also because it's like, well, the stigma, for sure. I agree with you. There's definitely been, I mean, there still is. There definitely still is.
Yeah.
It's better, but it's also, would you say it's also just how tricky it is, like, to study? Like you said, it's not like a cancer where you can be like, there's a tumor. Fucking deal with it, You guys are you deal with it. You see it day to day. I mean,
Yeah. I mean, the research on mental disorders, it's really complex and really tricky. I mean, cancer, I think it's also really complex and whatever. So, but on mental disorders, I mean, we know some of the genetic factors, but it's really, really tricky right now. But if you go back to the genetic factors, for example, the data comes from these huge genome-wide association studies where they take thousands or tens thousands of patients and control persons, and then they correlate different single or small mutations or whatever to a disease, and then they find a correlation. But this is just explaining it.
Yeah, that just shows you that, like, well, in people that don't have the symptoms of depression, their genetic profile looks like this, and people who do have it, their genetic profile looks like this. So
Yeah.
it just tells you that there's a difference, but it doesn't tell you what that difference, how it manifests, how it contributes to the
And sometimes
condition.
the difference is really small, or even the people, for example, with these small mutations, thousands of them don't have a depression, so it's not a good predictor to take one mutation and then to say this person might get a depression.
Right.
It's not working that way. It's really tricky.
Yeah, well, and I'd like to get back to what you're saying about the bias of trying to look for a biological mechanism or solution or something. I think this is an issue too that we're kind of starting to deal with, but you still see it a lot where people are like, or companies or something like this are like, well, let's just, like the wonder drug. Like,
Yeah,
can we just find the wonder drug that will just cure this?
I think sometimes they call it the magic bullet.
Right, exactly, yeah.
And this is what the patients are asking for.
Right, because they want to feel relief. Yeah.
Yeah, I hear this question almost every day.
Really?
And then I have to be like, yeah, if there is this bullet, I would give it to you, but there's none. It's not that easy. So we don't have this magic bullet.
Yeah. Well, and I think it's like, I mean, I don't know. It trips me out about this whole thing is that there is these multiple factors that go into it, like an environmental factor, let's say, or that someone who, you know, maybe they have the genetic profile, maybe they don't, but you can still succumb to depression, you know, like it can develop, you know, based on your environment and your mood. And I just don't think that we think about that, you know, like as much. And that's, I don't know, it's kind of scary. I mean, we were having a conversation before the podcast about social media, you know, and how much, how, we don't really know, but how much of that is contributing to people's depression and stuff like this. And so it's like, there's all these things that we normally do in our world, like, you know, we've created this world, the society that we live in, and it might actually be contributing to a deterioration of some people's mental health, right? Like if we knew, like when we know that microwaves cause cancer, we all stop staring at the microwave, you know? I don't know if you guys got told that as a kid to like not look at
I know this story, man.
But yeah,
I was really scared.
Yeah, you know what I mean? Like so like, I don't know, what's your thoughts on that? Like because they also talk about it. I don't know if they talk about this in Germany, but in North America, for sure, they talk about a mental health crisis. Like that there's a mental health crisis going on. And I don't know if some of that is, well, now we're just paying attention to it, so it's always been there, but now we just notice it, or it actually is increasing. I mean, I think suicide among, you know, men aged, you know, 40 to 50 in the U.S. is one of the chief reasons that their life expectancy has dropped overall. So, I mean, do you talk about that in Germany? Is that a thing, or would you have some kind
crisis or
like an epidemic?
From what I know, or in media right now, it's not. From my perception, it's not a big deal right now.
Germany also has a way better system of taking care of their people than
the
US.
In Germany, it's more about how to improve the treatment. There's a lot of stuff going on because people don't get treatment, and you have to wait a month, or almost a year to get like a therapy session or something. So you have to wait really, really long to get a therapist. So this is the discussion right now is focusing on that in Germany. I don't know what the situation is like in England.
I mean, the kind of public opinion is building around mental health and how important it is. So people are well aware. We're not in a crisis in the media. It doesn't say that. But people are pushing for more investment into the system because, like Germany, it takes a long time to get an appointment, and with more money you can do more things.
Well, and I think part of the mental health crisis that they talk about too in North America anyway, because they talk about it in Canada as well, manifests as addiction, like the opioid stuff too. And so then there's there's that contributing to it. And I don't know how big of an issue that is here, but I am curious about this idea that the way that we've designed life and like the priorities that people have in life aren't fulfilling to a healthy psychology, a healthy well-being there. I think I've probably talked about this before on this podcast. I think I've talked about it with you, but the book Tribes,
Yeah.
Oh yeah.
where it's like this. If you don't know, let me tell you the story.
Yeah, I haven't read it. I don't know.
Anyway, he was Sebastian Junger. He's a war journalist, but he kind of had this. He noticed that when he was talking with people or in these war scenarios or talking with soldiers or people who had gone through these things, is that they often reported like better mental health. Like they're feeling like if they were depressed, they were no longer depressed. And soldiers
During wartime.
wartime.
Okay.
And soldiers, he
Which
looked
makes
at
sense.
and he looked at the phenomenon of soldiers that like they want to go back to war, even though they say it's like it's terrible and stuff, but they want to go back because camaraderie, purpose, the love they feel for the guys next to them, that sort of bond. And so he developed this whole sort of idea and looked at during the Blitz in London, when the bombing was the heavy bombing campaign in World War II, it's like the rates of depression, people being, going to get treatment for depression, like it just vanished almost. And then as soon as the war was over, it came back. And the other example he used is people who, in North America, when they were colonizing the West, it was common for Native American tribes to kidnap people. Like as they were fighting the settlers and stuff, some of the people would get kidnapped and they would get brought into the tribe, and they loved it. Very rarely did they ever try to escape and come back to Western society, whereas if a Native American person was captured and brought to Western society, European society, they hated it and they tried to escape.
Oh, that's interesting.
Yeah, and the idea is just that there's community in those places, in those tribes and stuff. They have a strong sense of community, togetherness, sort of an appreciation of nature. Everybody has a purpose. You're appreciated. You're respected for what you can do. Whereas, whatever Western European society, whatever you want to call it, it's isolated. People are isolated. You don't have community. And you look at now, it's like you live in a giant apartment building, say in New York or something. You barely know your neighbors. You're surrounded by people, but there's no connection. And even social media. I mean, it's like, oh, we're all connected, but it's meaningless, right? You go to work, you come home. So it's this idea. And that to me is really fascinating. And I mean, it kind of goes to behaviors. And is there a right way, let's say, the way that we evolved to be healthy? And this is the other point with looking at tribes, because they're, pre-industrial. That's the idea, is that those are closer to how we evolved. They live in a way that's closer to how we evolved. Anyway, I just went off on that. Thoughts? Anybody?
Difficult to answer.
Yeah.
Tricky.
Yeah.
I mean, I definitely agree with the social media issue. You see people on the train or bus, for example, no one's talking to each other and everyone's looking down at their phone. I mean, I'm guilty of it as well.
Me too.
People say the death of conversation, and young people nowadays, it's like they're only talking through their phones. I mean, it's the way society is, but I can see that having a knock-on effect with mental health.
But is there would you, I mean, to the depression example, withdrawing is a symptom, right? Being withdrawn. So obviously, human contact, human connection, community is important. Like we can definitively say that, no?
Yeah. I think so, yeah.
Because I mean, isolation, putting someone in solitary confinement, you go mad.
Yeah, for sure.
Yeah.
But what is your question? With social media, you still have connection to other people, or is it like a fake?
But then I guess I would say, what is it about what are the elements of connection that are positive? Would you be able to dissect that out? It has to be physical, or it has to be this amount of time a day? Like, obviously we don't have these answers, but is that the right way to think about it?
I mean, are you socially fulfilled when you talk to your family through Facebook or Twitter?
Well, Facebook, no, because it's filled with stupid Justin Trudeau memes. But yeah, no. Well, I would say this: Skype, like having the visual of seeing somebody, definitely helps. And I mean, my parents, they were just visiting here in Germany, and they talked about that like a lot. That it's like my parents moved away from their family back in whatever the day they moved across Canada, so they were separated by at least a 5-hour plane trip, and they didn't have Skype. And my mom talks about this all the time. She's like, if I had Skype, that would have been such an easier thing for me, because you can see the person, so visual is obviously important.
Yeah, but I mean, Skype is different to whatever social media, Facebook, Instagram, or whatever. The kind of conversation, or it's not a conversation, or communication that you have on these platforms, it's totally different, right?
Yeah.
I mean, there's no real connection most of the time. You see some holiday pictures and that's it. I mean, there's missing a lot of stuff, right?
Yeah, people post what they want to post as well, so it's a very specific way in which people show themselves and communicate.
Well, you're presenting the idea that you're presenting a false image of what you're really.
Definitely.
Well, on Instagram for sure, yeah.
It's biased.
Yeah. And Twitter, obviously, I mean, like it's just not. It's you only have like 240 characters or whatever it is, to like. So it's not a great way to have a conversation. I mean, obviously, so these are the elements then that are important. So being able to spend time, flesh out the ideas, but like, I mean, there's something else, and it's got to be quantifiable, you would think. Physical touch, that's got to be part of it. Purpose. I feel like purpose is a big thing. I feel like a lot of people probably don't have purpose.
I mean, I think the very fact that people need these, like the social media, like daily contact, whatever, actually tells you that that's very important, even though it's not enough. So I don't see social media as, it's a weird way. I mean, I think it shows how important communication or being in touch is.
The fact that people are clamoring to it, and we all like have signed on to it.
Yeah.
So then, maybe it's you wanting to be heard.
And people adapt to these changes, right? Like very quickly. So if they're away, if you just have Skype to, like talk to your mother, then you just adapt to it. But the thing is that you need this connection, and you kind of try to use all the means that you have to get that connection. So I don't see social media as like, people are presenting themselves as fake. I mean, people probably used to do that before as well.
Oh yeah, there's
like
always
presenting
been bullshitters.
yourself to a neighbor in a certain way. I don't know if like when you're arguing.
Well, I mean, we all comb our hair before we go out.
Exactly.
Yeah.
So I think it's just a different way of showing that you need contact with all these people you know or you don't know. Doesn't matter actually.
But then maybe it's like a hyper version of it.
Maybe.
Because it's like you're connected with like thousands of people, or probably the whole world. But it's like, am I really connected with anyone?
And that's
situation.
I think that's the important question. Am I really connected to the people?
Yeah.
And maybe that's what we should talk about, because I mean, what's important in a good conversation? I mean, we always talk a lot, but what is important about these conversations? They might take a while. We talk about different stuff like today. Sometimes you talk about emotions. Maybe this is what you normally don't do on WhatsApp or whatever. Or sometimes you also talk about, like, if you're in a bad mood. This is what you normally don't do on Facebook or Instagram, right? You show you the positive sides of your life, but not the negative sides. And so maybe sometimes it's also important to talk about this stuff to maintain a good, I don't know, mental health status.
Yeah. So what's again like? What is the elements of connection that make it, positive for your mental health? I don't know. Aren't you guys researching this?
No.
Because there's a lot of people too that this is a criticism to stay on the social media thing. This is a criticism of social media as well, is that it breeds negativity. Like it kind of rewards negativity. So there is a lot of people out there like shouting negative things, and I think it's an interesting phenomenon too, to just like the fact that once we got this technology, how many people just started saying the most atrocious things to each other. Like that says something about the psychology. But I look at that too, is that like, well, these are people that are hurting, and they're missing something in their life, and they're using this medium, like you say, like you adapt to the mediums that you have, and you start. But I don't know, it's fascinating. I think that's like an interesting question. It's like, what is it? Like, can you quantify what a good interaction is between people, and how much of that do you need? Obviously it's going to be different for everybody, but and maybe I'm just falling victim to the magic bullet thing to be like, well, we can just regiment it. It's like everybody needs like, you got to go out and you got to talk to this many people, and they have to be, but there's something to be said about a lack of community.
Well, changing it quite slightly, you could think about when you meet people in a big city, no one is really talking to each other. Not just because of phones and social media, everyone has their own purpose. But then you go to smaller villages or little towns, everyone seems so much happier because everybody's interacting with each other. Here where we are now, you walk in the morning and people just say good morning, how are you? But then if you go to places like London, for example, no one wants to talk to each other. It's so closed, everybody has their own thing that they want to do, and no one's really social.
Yeah. We know that there is a connection between the size of the city and schizophrenia. It's correlated.
Really?
Yeah. There's like, it's increasing the risk of schizophrenia living in bigger cities.
And it's not just we're in a bigger city, so there's naturally going to be more schizophrenics there. It's not like a proportion thing.
No.
It's like the risk is higher.
The risk is higher, but I just know this fact. I don't know why. Maybe there are some.
I think there's also social inequality, like in big cities, people seeing that there are, like the conditions they're living are like very unequal and so on. I think that also aggravates.
But they also discuss pollution, whatever. So
I
there's a lot of discussion.
I would imagine just stress too.
Stress.
Yeah,
But
exactly.
then physical stress, psychological stress, different stuff. But there is a connection. So it fits to what you've said, Aaron. Yeah.
But what you're talking about, Aaron, too, like makes me think of the whole, what's that, like, there's like the number of like people that you can know or that you can remember. Is it Dunbar's number? Something like this. Have you heard of this?
No.
It's a researcher, and I don't know, he did something where it was like, this is like and again, I think he was, I don't know, again, I'm butchering this probably, but he looked at like tribal societies and stuff like this, and then did like memory sort of, there was some science to it, but it was like, this is sort of the maximum number of people that you can know and sort of maintain solid relationships with. And I think it was like 100 or something like this, and then beyond that, it's like you can add more people in, but you're not going to be as close to them or something like this. And that's what I always took the small village thing to be, is it's just like, well, there's just less people to, deal with. So you gotta, but it's true. And the other thing is, you go to places where countries that are, not like, we'll say like not as well off as, or industrialized or whatever as, the places where we live, people seem happier.
It's very true. Yeah, definitely.
So what, that's, again, that speaks to like purpose or perspective or something.
And again, there is also data showing that living in a third world country is reducing the risk of schizophrenia, for example.
Mhm.
So there's also something going on. So it fits to what you've said, that they seem to be happier.
Mhm.
I don't know.
The flip side of that I've always thought about is like, well, is it though that it's just like, if you're sort of struggling to get food or whatever, like day by day, you just don't have time to worry about how sad you are. And maybe that's kind of glib for the, like, it's kind of puts, de-emphasizes how bad depression is and stuff, but that it's just like, oh, well, I don't have time to be sad, you know? But is there something like, I don't know.
Well, as you were talking about in the book, you have a purpose.
Mm-hmm.
You know, it's something you can do. I mean, we're very privileged that we can sit down and scroll through Instagram for half an hour in your day, and it's pointless. You're doing nothing. But it's not really a purpose, you know.
Yeah. So it's like, I don't know, it's kind of, I've always like made the connection too with like diseases of affluence, like diabetes, you know, stuff like this, where it's like, or even, you know, they have the whole, have you heard about the hygiene hypothesis? Where it's like
why people are allergic or children
exactly,
are allergic.
Yeah. So it's like people, because we live in such a clean society now, we've cleaned up all this thing. We evolved to deal with a certain amount of worms or bacteria or whatever, you know, like, so our immune system is like ready to go for that. It's built for that. And then once we've eliminated that, it's like, I don't know what to do. So it starts attacking itself. And I've always kind of made a connection to this kind of thing too, which again speaks to like, well, have we built like the goals of, this is going to now start sounding super, well, I'll take a step back and say it's not super philosophical, because clearly I'm just a dum-dum with a microphone ranting into it, but you know, it's like we've built society based on the wrong goals. You know, it's an idea I've been thinking about a lot, and it's, I don't know, it kind of makes sense. What should the goal be?
Yeah, what do you think is the main goal right now in society?
Money.
I think I have the same idea.
I was gonna say growth. That's the stuff that I've been
True.
looking at a lot too. It's like there's always this like growth. We got to grow the economy. We have to build. You know, we got to this.
But this is directly connected to money.
Yeah, exactly.
So
I think it was this week, Denmark, I think, in their list of priorities, for the first time ever put mental health, people's well-being above GDP in their budget, I think.
Really?
Yeah.
Interesting.
Very interesting.
Well, because, you know, this isn't my original idea, but GDP is a terrible way to measure the like well-being of your citizens.
Oh, without a doubt.
Yeah. And so this is, you know, I mean, we're talking about mental health and like all these things. Maybe this is, you know, we're coming around to this point that like we have constructed a way that's not healthy for our well-being.
Well, money can't buy happiness.
That's what they say. But let's take a moment to remember the great Ja Rule. When he said, money can't buy me happiness, but I'm the happiest when I can buy what I want anytime that I want. But I absolutely agree.
Yeah.
But the interesting thing about this too then is that it's kind of biological, right? Like biology, you know, like life is about consuming. You know, you consume resources, you grow, you reproduce. I don't know if you guys have seen in Marburg on the streets
Please
here.
don't reproduce.
The anti-reproduction graffiti.
Yeah.
Yeah.
I've never seen it.
Yeah. I don't know, and I mean, I'm assuming it's like the climate activists and stuff, getting overpopulation and stuff, and which is it's a thing for sure. But to like say to someone, don't reproduce, it's like this is ingrained in our biology. This is what we do, you know. And so this idea of growth, and it is kind of a biological thing, but we've always had before technology and stuff like this. There's always, you know, the rest of the environment would keep you in check. Disease, or, you know, there just wasn't enough resource, so you couldn't, you know, but we've kind of eliminated that, and now we're operating outside of the the normal boundaries of the ecosystem. And so I mean, it's not good for the planet, but maybe it's also not good for our mental health.
I mean, right now we have the advantage that we live in a society, at least in Germany, maybe in North America too, or in Europe in general, that we can focus on stuff like mental health, or that we can address it, that we can try to improve it. And I mean, you've mentioned the mental health crisis in the US. I think in the papers I've read about German statistics on mental diseases, is that it's not increasing, but that people are getting more and more aware. That
So the diagnosis is getting better.
Yeah, that the symptoms they are experiencing are not like a somatic disorder, like a biological disorder, but that they are like psychological disorders or problems. So that the diagnosis is changing. This is what they find in the data over the last decades. That so the diagnosis is getting better in general, or the doctors or clinicians, whatever, they get better to find a mental disorder. So yeah, this is increasing.
Right.
So the awareness, or that we now have, the resources to address these problems in general, and this is an advantage right now.
So the idea being that like maybe like these people we've always had like the same level of mental illness forever, but we just now know what to call it. Like we can now look at that and say, oh, we should do something about that.
Yeah, at least for the last 20 or 30 years. That's the papers I've read about for Germany. There's a minor increase in affective disorders, so in depression. There are some hints that depression rates are increasing, but for like anxiety disorders, it's keeping the same over the last decades.
But I think that's the one that most people talk about. Like, again, I'm just thinking of like North American media and stuff as like the mental health crisis. It's depression. It's not so much schizophrenia or these other ones that sort of manifest in this very drastic kind of way. It's like depression is really the biggest one, and maybe it's like we've had like legions of depressed people all along, and we just never knew, and it's just like everyone's always just been like, suck it up, I mean, it's the same with PTSD, right? Like after World War One, they actually started looking at it and they called it like shell shock or something like this, but it's like, oh no, these people are just like the extreme stress, but I don't know, it's I feel like it's probably a combination of both. This is again me speculating. I don't know if you guys have picked up on this yet, but this is what the podcast is all about, is just speculating about things.
But now let's go back maybe to the behavior part.
All right, let's do it.
So in our society right now, what kind of behaviors do you think we show that are like negative, or that might increase depression rates or whatever? Do you have ideas what kind of behaviors we are showing?
What kind of behaviors are showing? I mean, I think isolation. I think people are isolated.
For sure.
Yeah.
I think that's one. I also think that people like purpose. I think there's a lot of people that maybe work in jobs that they don't like, and they feel like, oh, I'm just here punching the clock or whatever, but that's it. Like they don't see especially when it comes to like financial jobs, it's like, oh, I'm moving numbers around, but like, what am I doing? I'm not building anything. I'm not creative. I'm not, that's my thought. Oh, those are our guests.
I'd maybe add overworking to that.
Yeah.
Overworking, yeah.
Having 2 or 3 jobs or whatever. I mean, this is what you hear, or what I hear from the US for example. There are like thousands of people that need two jobs, 3 jobs
to make a living and
to make a living.
And that comes to the wealth inequality thing too.
Yeah, exactly.
But then there's also like commuting. People that commute over an hour to work as well. That's an extra 2 hours a day. and you're not really working during that time.
And not getting paid for it.
Yeah.
Yeah.
No.
Sure.
Come on in. 2 other friends joining us. You guys are hopping right into our lovely conversation about mental illness. Yeah, I mean, I don't know, so isolation, purpose, lack of purpose,
Bullshit jobs.
bullshit
I
jobs.
think
Bullshit
that's
jobs.
what they call it, right?
Yeah.
Stress, right? Stress would be a big
Stress.
thing too. I mean,
Yeah.
how
I
many
mean-
people, are so stressed out about being able to put money or put food on the table, So,
I'm not sure how that's affecting Germany or how big. Is that a problem in Germany?
I mean, I just can tell you my personal opinion, but sometimes, or in Germany, we sometimes have the feeling that we are like 10 or 15 years behind the United States. And we always look at the United States and then we're getting nervous because,
in terms of what, like productivity or something?
like working conditions, low wage jobs, whatever, 2 or 3 jobs at once to make a living.
I'll take a beer. That's good. Thank you.
Okay, looks like I'm here
Thank
to
you.
serve.
And I mean, in Germany we have the same problem. I think we have like 40% of people have like really low incomes, like the minimum wage income or around that, and I think that's a huge problem. That's this is my
Right.
my
Wealth
personal-
inequality, I mean, that's rising all over the world. So, but then what is it? What's the behavior then there? It's like stress, or I guess not behavior, but like how does that contribute to the mental illness? Stress,
Yeah.
feeling left out, feeling, alienation. I mean, I
This
think
might
that's a
be
big thing.
different reasons. I mean, then there's a lot of stuff connected to stress. If you're stressed, you drink more alcohol, use more drugs, smoke more cigarettes, whatever. I mean, it's a lot of different stuff coming together.
All right, Uzga, are you going to join us?
Sure. What are we talking about?
All right, this is Uzga. Uzga's been on the podcast before once too, so we all remember. We were talking about like what conditions or behaviors or something you notice in society that would be contributing to a bad mental state. I brought up the idea that like maybe we're living in a way that isn't positive for our mental health, and so isolation is something we brought up. What were the other ones? Purpose, a lack of purpose, people feeling a lack of purpose.
Inequality.
But and to me that kind of goes to alienation. Like you feel like resentment that like I'm not part of the thing,
Yeah, I don't know, maybe like compromising, so maybe like the people getting away with certain stuff because they are never told about their bad attitude, stuff like this. So that people who are I don't want to give examples from work, but who get away with what they do, and
Did you have a bad day or?
no,
No, I'm just
bad
kidding.
week, yes.
But then that again, like it sounds like it's like a resentment thing, or like you're working very hard but you're not getting the recognition or the And I mean, I think that's for sure. I mean, I always kind of boot the examples to the US because they seem to be kind of like you said, like at the extreme, like they're ahead of everyone else in terms of inequality and all this stuff. But it's exactly that, like so many people must see these guys, like I used the financial example, they just move numbers around and they make $1 million, and there's a guy down there, busting his tail every day and getting nothing. Like that's got to build resentment.
Definitely.
But
Yeah.
anyway, we were kind of talking about like this mental health crisis. Is there a mental health crisis? Is there not? But yeah, I don't know. And like is normal with these podcasts, we have more questions than answers. But
Yeah.
anyway, We're glad you're joining us, Özge,
Yeah.
with your you're a bit
I'll
tired
be ready in a bit, yeah.
and you brought us all the
Oh,
drinks, so it's all good. The other thing that we could touch on, I mean, other than the social media, the cognitive behavior stuff. I mean, I think the cognitive behavior stuff is great to deal with some of these problems that we've just alluded to. It seems to me like a really great, like it makes a lot of sense. Like it's very logical and it makes a lot of sense. But you kind of said at the beginning of the show too that there was like some pushback for certain disease, like psychiatry didn't want you to tackle schizophrenia or something like that. But I don't know, like it makes a lot of sense to, well, let's look at behavior, let's look at, how we're living, how we're acting, and, change it. Be the change you want to see in the world. I just came up with that now.
Amazing.
No, but do you think it would be possible to deal with a syndrome like schizophrenia by, like, I don't know, therapy?
Can you therapy away delusions?
You mean by using
By
psychotherapy?
using psychotherapy.
I mean, they use approaches to do that, but I have no experience with this kind of stuff, so I don't know. They say it's
Remember,
possible.
this is a podcast.
I know,
You can
I know.
speculate all you want. No one will hold you to it.
No, I mean, there's also the thing that by psychotherapy you can also boost, like, alter certain neurotransmitters in the brain, actually. So that might be, of course, a way, but a case like schizophrenia, I don't know.
So you said by changing behavior, you can change the brain chemistry.
By going on to, so this is what behavioral therapy is, I guess, is focusing on, and it changes the neurotransmitter levels too.
Yeah.
I mean, but this is again the more biological
The
way
psychiatric.
or the psychiatric way of
Right.
looking at like dopaminergic system or whatever, and you also and the assumption that you change the system with psychotherapy, and you could also use this magic bullet to change the system. I mean, this is one understanding of these diseases, but I don't know if it's really true.
It's not the whole picture.
It's not the whole picture. It's just one idea.
Right.
Yeah.
But by changing behavior, there is like measurable changes in brain chemistry.
For sure.
Right.
Yeah.
That's true.
So then where's the magic bullet? What behaviors?
Yeah, but schizophrenia is a different situation. I mean, completely different. It's I don't know. I think it's not that easy.
Well, and I mean, now I feel like we're coming back to a thing that we talked about at the beginning, which is great. It's fine, but it's like, and I'm kind of biased towards it, being my training was biology, but I feel like if we had all the data, like if you could just like scan everybody's brain and get like all the genetic data, all the brain chemistry data, something like this, there must be a way that you could just be like, do a little bit more of this or tweak a little bit more of this, and then you're fine. But then would you just be like a mindless robot? I don't know. Like how much of it is...
I mean, right now they are trying to adapt this strategy by like using this artificial intelligence, whatever stuff, giving the computer all the data you have, all the brain scans and all the blood sample data and all the behavioral data and all the whatever stuff you've collected, and then you try to train the computer to find differences between, for example, depressed persons and control persons, but right now it's not working like this, so it's...
Is it just a matter of we don't have the computing power?
Maybe, I don't know.
Or is it just
Ask
like
the
the
computer
wrong way to
scientists.
think about it?
Or maybe it's too complicated.
Exactly. Not everything is so predictable, so computable in a brain. Probably.
In a condition like depression, I mean, that's how I see depression. It's very complicated, I think.
Yeah, it's awesome.
Like there can be so many reasons, right? So I don't think it's that easy to predict depression based on, I don't know.
Well, not biology. We'd have to map all the environmental factors and
Sure.
stuff too, stress, all that stuff. Here's something I want to ask you guys about. That just popped into my head, so maybe it's... Is there... You know, there's those studies that talk about stress impacting the children of people who are stressed. Do you know anything about this?
Yeah.
Is that... What's the story there? Is it true?
Yeah, that's epigenetic events happening.
Right.
Um,
But so how big is the impact, I guess, is what I'm curious about.
yeah, I can talk from the animal studies. So there are really severe cases where the mother, for example, so even the babies, the embryos in utero, they were prone to stress. And then the mother, before going into breeding, they were stressed, and the severeness. So the more severe it gets, the entire stress phase for the mother and the embryo later on, there is more likelihood for the next generation to develop certain psychiatric conditions. And it also includes certain cognitive dysfunctions. Yeah. And this is believed to work via epigenetic events, because that's not in the genome of the mother actually, what is being transmitted, but it's it's
an environmental...
Yes.
Yeah, it's an environmental effect.
And then when they are, for example, prone to stress, and then are exposed to stress during the early life, that also increases the likelihood that they develop psychiatric conditions later in life.
And I mean, I know that this is animal studies, so it's...
Yeah.
There's the caveats that come with animal studies, but it's like, it seems to me like, how do you quantify stress? Because I'm thinking about like a discussion we had before you got here, Iska, about people in, second world, third world countries or whatever being happier. But I would think that they would have more stress. And like just in general, as, like let's, go back 1,000 years, 2,000 years or something, wouldn't we have experienced as humans more stress in terms of like, there's animals, there's war, there's this. So wouldn't we all be then fucked up? Because we've all been like, it's only now that like our parents aren't stressed.
Yeah, well, but I mean, in those countries, yes, there's different kind of stress, but I think in the Western world, there's this daily stress ongoing about work, money. It's adding on so much. I think it's an accumulating effect.
So it's not like an acute, like, okay, there was a danger, there was an acute danger that I had to deal with, and now it's done, and then I can go back to being less stressed. Now it's kind of just every day there's like a slow amount of stress, but which kind of makes sense, goes to what we've been talking about. So all of our kids are going to be screwed.
But
it's about finding the balance.
Not due to mental illnesses. The climate would be the problem.
Yeah.
Right. Well, and this is another like.
But what's also very common is the immune deficiency later in those kids or like generation, let's say. So I cannot think of human studies at the moment, but in the animal studies. So that's one side effect as well. Let's say you being so much under stress that you
your immune system is not as good.
And that you pass on to this next generation. Actually, the next generation gets immune deficiencies.
Really?
Yeah. certain immunological factors are increased.
Do they know if that's just like during development, it just doesn't develop properly, or do we know what the mechanism there is?
We might, but I don't know at the moment.
Yeah,
I
okay.
can't tell.
It's okay.
Yeah.
Podcast, speculate away.
Yeah.
But the climate change thing, Toby, I think there's another thing that's like, there's people talk about the stress of that, you know, and that there's a whole generation of kids, like all the, you know, Friday, Future, whatever, the Swedish girl, I can't remember her name now.
Greta Thunberg.
Yeah, that's the one. But that there's like, how do we handle a problem like that? Because like this is putting a lot of stress on people and kids. But again, an open-ended statement that speak away.
I'm not sure how we can handle that like situation. No idea. I mean, as severe as it is right now. So we can be very pessimistic about it as well. I don't want to talk about it because I would be very,
Does it stress you out?
Me personally,
Mm-hmm.
no, to be honest, because I will die in, I don't know, 30, 40 years.
Yeah.
Yeah, really, and I don't have kids.
The
so
same ideas.
I don't have the anxiety.
Mm-hmm.
But Rainer was talking about this, because at the university, the students some weeks ago, because there was the special week for the climate change, and the students asked professors to include in their lectures this topic in a certain way. And Rainer, teaching biological psychology, he actually first had no idea like how to implement it into his lecture, climate change. And then he said he did a bit of research, like just literature search. And what he could find was people like at this attitude and others. So, for example, thinking for future generations.
Yeah.
Okay, I really am worried about the future generations, and then some saying like, well, I don't know, I'm gonna die anyway, so I don't think so. Like two groups, and then showing, I think it was MRI scanning in these people, showing differences, etc. Yeah.
Huh.
Yeah.
Probably.
So there's
Maybe
different...
being more individualistic and more altruistic. I don't know.
Right. But I mean, this is also one of the problems. I mean, we were talking about the reproduction thing, like biology, and how some of these things we can't fight against. But this is another like a thing that's pretty common with humans, is like lack of foresight. You know, being able to like look that far in the future and you know, or even just like look at a group from another place and say, well, why should I give a shit about their well-being, you know? Or why do I care that much about the future? I need to deal with my stuff now, which is kind of an interesting, we touched on it a little bit earlier, of like, how do we deal with our biology and live within the realm of, you know, the ecosystem and whatever. Like we've kind of, in some ways we've surpassed biology, and in other ways we're still slaves to it. We're still victims of it. Well, victims maybe is a strong word, but I'm trying to make for good radio here, you know? But it's interesting. It's interesting thought. I think we're getting pretty hungry now, eh?
Yeah.
I've made burritos for everybody, so let's wrap it up. But thank you guys for being here. Thanks for doing the podcast. Appreciate it. It's fun discussion.
Yeah.
Hope you enjoyed it. We should do it again.
Okay.
And Merry Christmas, everybody, and we'll catch you next time. And there we have it. Fun little chat. I enjoyed it. I'd like to get these folks back on again, and maybe myself do a little more prep work so I can really grill them about a few more things, and get some more details. But like I said, we just had a casual podcast and dinner, and it was a blast. I really enjoyed it. So thank you again to everyone for coming out. Thank you to everyone for listening. We will have hopefully at least one more episode out before the end of the year. If not, take care, everyone. Have a good end of the decade, and we'll see you in the new year. Take care.